Today is the start of Infertility Awareness Week, and if it sounds familiar, we've talked about this last week, and we did discuss that 1 in 8 couples do face infertility issues and are unsure of what to do or where to go for help. And if you haven't faced this yourself, you likely know someone who is just fighting to have that dream come true of having a family. Well, last week we were joined by ER physician Dr. Jerisa Berry about ways to track fertility. Dr. Berry was kind enough to come back with us today to talk about the launch of her fertility tracking app as well, that I know we've got a lot of response to. We talked about this on Facebook Live and many people responded.
A lot of questions.
Briefly,
yes.
Real quickly, capsulize your story for anyone who wasn't with us last week, please.
Well, unfortunately, my husband and I went through infertility treatments for about 2.5 years. And we went through several IUI, IVF, and actually our last IVF was unsuccessful initially, but successful in us having 2 embryos that we have. We've gone through the process emotionally to accept that we will be using a surrogate, and we're happy about that, that there are women that are willing to carry, you know, another family, another couple's child. But
they feel the heartache,
yes.
and they do it for,
yes.
They're doing it with you and for you, but you understand the emotional upheaval this is for men and women, not just women, but men, the guys who want to be dads.
The guys, yes, the husbands.
So you got to work and you created an app, and we've got viewer questions to get to. We want to talk about your app. Let's start with the app real fast, that you did this. How do women use this app to track fertility?
So we're excited about the app. We will have it available by the end of this week. Final touches now. It's called Secure Your Fertility app. What it will do is allow women a sense of where they may be on their biological clock. It will give them a sense of how much ovarian reserve they may have left. So it's a wonderful test, and we're happy to have the backing of several specialists that are supporting it.
How interesting is this? So they go to the App Store, Secure Your Fertility.
Yes.
Okay, and then they can download it and start put it right to work.
Yes.
Excellent. Now, we did a Facebook Live last week. Many of you were with us, and you've been asking me about when we were going to get these questions going. Here we are. We're going to ask you questions. We're going to get some answers.
Okay.
Might get a little rapid fire. We've got a lot to get to. So, the first one was about insurance. We had a lot of insurance questions. What does it cover? And maybe briefly, is it easier to say what it doesn't cover? Or?
Okay. Every insurance plan is different. So that's the unfortunate thing about it, is you have to check and see with your insurance company and what you're covered with, because one insurance plan under United may cover fertility, and another insurance plan under the same insurance company may not. And there's different degrees. Some may cover, you know, a few thousand, some may cover the entire treatment. So it is available, but you have to check with your employer or your specific insurance plan, because they are different.
And I also understand that it sometimes, and this is from covering this for years and years, as issues have evolved, as there have been breakthroughs in fertility and infertility issues and addressing them, many doctors, if you talk to them, specialists, will work with you and with your insurance plan to try to help out. Yes. But it takes talking, it kind of takes a team effort. You and your husband talking to your doctor, your fertility specialist, and your insurance company.
Yes, yes.
How much does stress affect fertility?
Quite a bit, quite a bit. Stress can affect the quality of eggs. So it takes 3 months. It takes 3 months for an egg to mature, for an ovary to mature an egg for ovulation. So essentially for the 3 months prior to when you're ready, if you're under a lot of stress, unfortunately, the toxins, the emotional, the hormonal imbalance
just hurts.
Sets you back. Can cause difficulty with ovulation and also the quality.
We're running out of time. Does hyperthyroid affect fertility?
Yes, hypothyroid absolutely can affect fertility.
Hypo.
Yes.
Celiac disease, yes or no?
No, celiac is more of a gastrointestinal disease. It's not necessarily affecting your hormones or fertility.
PCOS, want to know what it is?
PCOS, very common. Actually, one of the more common causes of infertility, polycystic ovarian syndrome, affects about 10% of women nationally.
We have answered a number of questions. I know there were many, many more, but Dr. Berry does join us on a regular basis. Please email me or get in touch with me through Facebook messaging if you've got other questions. Continue the discussion. Thanks for sharing your journey and the app as well. Secure Your Fertility app. Thanks again.